Good nutrition is important for all children because they need to grow. And the particular problems that we see with children with chronic kidney disease is that they have very poor appetites, and that's just a feature of having an underlying disease. So all children who are sick quite often lose their appetites, don't want to eat. But what's particularly important in children with chronic kidney disease is that they need to get the right balance of nutrients. So we're not just looking at good nutrition so that they can grow and develop normally, but we'll need to adjust their diets according to how well their kidneys are working and whether they might be on dialysis or whether they're on conservative treatment for their disease. One of the first types of food that children might need to start avoiding are foods which are high in phosphate. And so those, the sorts of foods that young children like are things like yogurts, fromage frais, custards, rice pudding, ice cream, chocolate, the sorts of foods which are easy to eat because when you don't have a very good appetite, you don't have to chew them very much, you can swallow them very easily. They're good sources of calories, so we like those foods for that purpose, but because they're high in phosphate, that can have deleterious effects on the child's bone health in the long term. So what we need to do is to always balance what their blood levels of phosphate are, and then balance the diet to make sure that they don't have excessively high intakes. So it's very important that we see children very frequently. So babies we may be seeing every week, every fortnight, toddlers fortnightly to 4-weekly, because we expect them to grow every time we see them. And each time they come up, they will have a blood test so we can see what their phosphate levels are like, and therefore we can adjust their diet accordingly. If we're asking families to cut out certain foods in diet, we can't just leave them high and dry saying don't eat these foods. We need to be able to offer alternatives. And I think what the parents find particularly difficult is being able to find snack foods that young children and babies would maybe have in between meals, which would normally top up their calorie intake. So that's probably the biggest area where we need some help. Because again, lots of snack foods which are easy to eat, like some of the ones I mentioned, the yogurts, the fromage frais, it's very difficult to replace something that's easily got off the shelf. And so it means that families need to do a bit more home cooking in order to replace those foods that we're asking them to take out of their diet. If we're taking out a lot of milk products, then we're really left with foods which are lower in phosphate. So we're talking about using lots of grains, so baked goods, cakes, biscuits, buns, that sort of snack food which will replace those high phosphate foods. But again, that sounds like a not very healthy diet when you think about the general population. But for children with kidney disease, those are the sorts of foods that we would be encouraging because they're high in calories, they're lower in phosphate. And of course we can ask them to eat fruits and vegetables so that they're getting their 5 a day if that's possible. But again, with older children who are going into end-stage renal failure, they may need to start restricting the potassium content of their diet, which automatically means that they then have to start restricting fruits and vegetables. So you can see that managing the diet on a day-to-day basis is quite a challenge for these families. One of the problems with manufactured foods, things like sausages, bacon, ham, the sorts of foods which are popular with children, they contain a lot of phosphate additives which are just there as part of the manufacturing process. So to try and replace those foods are quite difficult. So it means, again, as I said before, using more home-cooked foods and starting from scratch rather than relying on shop-bought foods that may have these additives in. First of all, it's very important to take an assessment from the family about how the child eats and how the whole family eats, so that any advice that we can give them can be tailored to their lifestyles. And what we try and do as far as possible is to have the whole family eating in the same way as the child who has the illness, because otherwise they can be very isolated if they're eating differently. But then I think families need to accept that their other children need to have treats as well. And one of the things we're looking for is to have some bespoke recipes, if you like, for treats that the child with kidney disease can have. So we're looking for good, tasty, savoury snacks, nice sweet snacks and puddings. So we're looking at foods which are going to be low in phosphate, and for many children they may need to have a lower salt intake as well as their kidney disease progresses. And for those children that are on a potassium restriction as well, we're looking at all three things. So you can see it's quite difficult to be able to give tips for the family how they can all eat. It sometimes means that the child with the kidney disease does have to eat a little differently from the rest of the family. First of all, we want it to be high in calories, so I don't think we need to be worried if we're frying foods. And again, that may slightly go against what families are doing for their other children, where they're trying to perhaps reduce the fat and sugar and salt that their children are eating. For the child with kidney disease, fried snacks are fine because they give plenty of calories. So we're looking at something like a crisp type snack or a corn type snack, but what we don't want is for it to be salted, because again, as children go further into end stage disease, and particularly those who are on peritoneal dialysis and hemodialysis, they need to be on a relatively low salt diet. The problem is if they eat a lot of salt, they feel thirsty. If they're thirsty, they drink a lot, and then they may retain that fluid because that kidney isn't working very well. And if they are constantly fluid overloaded, then that does have implications on their blood pressure and eventually on their heart health. So the key for us is to find high-calorie snacks which don't have the usual salt load that your average packet of crisps or other type of snack would have. Again, we're looking at using a lot of cereal-based foods, starchy foods. So any wheat-based goods, breakfast goods like croissants would be good, brioche, that sort of thing, cakes, tarts, crumbles. So again, it's the sort of thing that most families would avoid because they're so high in sugar. But the advantage of those foods is that they have plenty of calories, they're low in phosphate, and they're low in salt. So those are the three key things I guess we're looking for. I think families really do appreciate having recipes because they do run out of ideas of what to do. But we also need to remember that each child is an individual, and there isn't any such thing as a renal diet, because often we get asked, can I have recipes for renal disease? But each child has very individual requirements. As I've mentioned, most children will need to cut down the phosphate in the diet, but they won't all need to cut down potassium, they won't all need to cut down salt. And so we would need a good variety of recipes so that families can dip in to the sort of recipe that matches the stage of their child's illness. But I think any help that you can give families would be much appreciated. One of the features of chronic kidney disease is children do have a very poor appetite, and this is due to various hormonal changes that happen when your kidneys aren't working properly. The normal hormones that regulate whether our tummies feel full or empty, whether we feel satisfied with food, that stimulate hunger, are just at abnormal levels in these types of children and young people, and so that absolutely works against them wanting to eat food. So when they will say to their mum, I don't fancy eating, I don't want it, it's not them being difficult, it's not a younger child being naughty, it's just the whole environment of their body doesn't allow them to have an appetite, and that's what we're struggling against a lot of the time, which is why we so much focus on foods being high in calories, so that we know that every mouthful that they have really counts. And for some children, they can't get enough nutrition just from eating. Many children will have to have supplementary drinks to try and boost up their nutrition, and some will need to have tube feeding, particularly in the younger age group. But that shouldn't be seen as a failure on behalf of the child or the parents. If they can't get enough nutrition through eating, then we can supplement that with tube feeding, and tube feeding should be seen as a friend to the child rather than an enemy, because it's there to get good nutrition in so they can grow normally. One of the side effects of chronic kidney disease is that children can be shorter than their peers. And that's often a consequence of not having good nutrition in their very early years. And so we particularly concentrate on the first 2 years of life to be seeing these children regularly so that we can get them well nourished, and that sets them off on a good track to try and get normal adult height when they go out into the big wide world. Sometimes children do have bone disease as well, which does affect their final adult height. But that also can be helped with the right sort of medication management throughout their childhood.